Welcome. Thank you for joining us for Family Resource Centers, supporting families experiencing homelessness. I'm Robin Shemwell, and I will be your moderator for today's webinar. If you're joining us online, you may listen directly through your computer speakers. If you have joined via the phone number that Zoom has provided, your line has been muted to minimize background noise. For those of you online, please note the link to the Dropbox folder in the chat. Here you'll be able to see that there are some handouts available for download. In addition, you may put questions in the question section at any time. The chat section is open for you to include any comments during the webinar, but we ask that you direct all of your questions to the Q&A section of Zoom. Live tech support is in the room. If you have any technical issues, please reach out to them in the chat. Today's PowerPoint, the handouts, and a recording to this webinar will be available on the NFSN website on the Webinar Wednesday page this time tomorrow. When you exit the webinar, an evaluation will automatically appear on your screen. We ask that you do take a moment to complete this as it provides us with valuable feedback to inform future webinars. So our webinar today is presented by or co-presented by CSH. CSH is the national leader in supportive housing, focusing on person-centered growth, recovery, and success that contributes to the health and well-being of the entire community. Again, my name is Robin Shemwell, and I'm an administrative coordinator at the National Family Support Network, and I will be your moderator today. So we would like to get started with a couple of polls to find out who is in the room today. So go ahead and review this slide, see how we've broken up the US into different sections. And we're going to launch a poll here. And let us know where you're joining us from. I am coming to you from the Midwest today, where we are enjoying some very nice weather for sure. So let us know where you're coming from. Give a few more moments for folks to add in their responses. All right, let's see those results. All right, so we have strong representation on the West Coast. We've got some folks from every region, it looks like. And if you're from other international, let us know in the chat where you're coming from as well. All right, so we are going to go ahead and do another poll here. Now we would love to know, what is your affiliation? We're going to launch that poll. Give a little bit of time here. Let us know what your affiliation is. And if you don't see where you're coming from, so if you're a family resource center or you might be a similar family support program, let us know in the chat if you're coming from a type of program that is not included here. And if the poll isn't coming up, you may need to go to the bottom toolbar on Zoom and may need to click on polls, but it should jump up for you. All right, let's see those results. Okay, so we have over 50% of folks that are coming from a family resource center. Awesome, we've got other family support programs, some folks from family resource center networks, education, government. Awesome. And you can let us know. Again, you can let us know in the chat if you're coming from one of those that is not covered. And we have one final poll here that we're going to launch. We would love to know, what level do you work at? So FRC folks working at the program level, or those of you who are, coming from homeless outreach, homeless service providers, or are you at the systems level, kind of thing. Give a couple more seconds here for folks to add in their responses. All right, let's see those results. All right, so we've got 60% of folks coming from program and direct service level, absolutely, and still have representation from policy systems, management, and other. Thank you all so much for responding to those polls so we can get an idea of who is in the room today. So I'd like to share with you a little bit about the National Family Support Network. Over the last decade, the NFSN has quadrupled in size to now have 39 members in 38 states and the District of Columbia that represent more than 3,000 family resource centers that serve more than 2 million people annually. The newest member is Nebraska, who joined earlier this year in the spring. So the vision of the mission of the NFSN is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of family resource center networks and championing quality family support and strengthening practices and policies. To summarize our vision, this is about turning that whole map that you just saw green so that all families will have access to quality family support services in their communities provided by FRCs supported by strong networks. So for our time together today, we're going to start with an introduction on family resource centers, or FRCs as we call them. Then we are going to look at 2 examples of FRCs that are supporting families experiencing homelessness. First, we'll hear from a community-based FRC, Compass, in San Francisco. And then we will hear from a school-based FRC in Arvin, California. Then we'll do a Q&A. We'll go through some resources and opportunities, and then complete with an evaluation. And again, folks, if you have any questions, we do ask you to put those in the Q&A portion of Zoom. So thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar as what we like to call America's best kept secret. A family resource center is a community or school-based welcoming hub of support, services, and opportunities designed to support families to be strong and successful. They may be community-based, like the image on the left of a family resource center in Vermont, or they might be school-based, like the image that you see on the right from Kentucky. They may be in rural settings, like the image that you see on the left from Colorado, or in urban settings, like the image that you see on the right of a family resource center in the Bronx in New York City. Wherever they're based, FRCs work with families with an approach that is not only 2-generational, but multi-generational, strengths-based, and family-centered. So each one of these concepts that we have listed on here is important. So have you heard of 2-generational or 2-gen work? Family support and family resource centers is the original, not just 2-gen, but multi-gen work, as programs work with children, parents, and grandparents as well. They're strengths-based because we see families as having strengths that we want to support them to build upon. And family-centered because everything we do has families at the center. FRCs are designed for all families, not only low-income or highly challenged ones. So the support they provide is non-stigmatized, making it more readily accessible. Programming is provided at no cost or low cost for participants. And the image to the right is of a family success center in New Jersey. There are 57 family success centers across the state's 21 counties. Each county has at least one, and typically for more than one family success center. That includes highly affluent counties, as well as highly challenged counties, because again, the belief is that all families could benefit from access to support for 2 of the most important roles we can have as adults, being parents and being spouses or partners. Two of the most important roles we could have for which we typically receive no support or training, hence the value of universal access to FRCs. So if you want to let us know by raising your hand, if you go to your Zoom toolbar on the bottom, you should have a reactions and be able to raise or lower your hand. How many of you have heard of the protective factors framework today? You can also let us know in the chat. And let us know in the chat, since I can't see everyone, I should say. How many of you have heard? I see some me's. Yes, yes, yes. Okay, awesome. In the chat. All right, so the protective factors framework come from the Center for the Study of Social Policy. Research has shown that these 5 protective factors increase family stability, enhance child development, and reduce child abuse and neglect. So as we're working with families, we want to support them to build these protective factors because we know they make a positive difference. These protective factors listed on the screen are parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, and social and emotional competence of children. For more information, you can go to the link here for CSSP's website. And again, this will also be linked in the presentation materials that will be available at this time tomorrow. So as conveniently located hubs, family resource centers bundle and co-locate many services that may be familiar to you, such as home visiting, evidence-based parenting, education, health screenings, play groups, fatherhood programs, family counseling, and food banks. Despite their organic development and varied funding streams across the country, there's a remarkable similarity in their most common service areas. These are the top 4 based on research funded by the Robert Wood Johnson Foundation. Be parenting support, which exists on a continuum from a lighter touch to more intensive services, as you can see here. Then there's access to resources, which also exists on a continuum from a lighter touch to more intensive services. Then there are activities focused on supporting children's healthy development and activities supporting parent leadership development, such as parent advisory committees. And FRCs not only provide programs, but build communities of peer support for families to develop social connections that reduce isolation and stress, which are highly correlated with child abuse. So now I'd like to kind of set the scene for what families experiencing homelessness in the US. So we have some statistics here on the screen. First being that homelessness in the US has been on the rise since 2017, experiencing an overall increase of 6%. Of the homeless population in the United States, roughly 34% of folks experiencing homelessness are families with children. And 84% of those families are female-headed. And it's important to note that homelessness exists on a spectrum and doesn't always mean that someone is unhoused and sleeping on the street. Families may be literally homeless. They may be in shelter care. They may be at imminent risk of losing their primary nighttime residence. They could be doubled up with other families or couch surfing. And most single parent families are female-headed. And as we see on this last bullet point here, many family shelters do not accept men in their programs, causing families to separate when they become homeless. In addition to this, single parent families are among the poorest in the nation, and as such are extremely vulnerable to homelessness. So now that we have given an overview on family resource centers, as well as some statistics on families experiencing homelessness in the United States, I'd love to turn to our wonderful presenters that we have here today. We are going to start with Compass Family Resource Center, and we'll be hearing from Monica, Erica, and Clark.
Hello, everyone. Welcome. My name is Erica Barajas. I am the Program Director for the Compass Family Resource Center, also known as CFRC. We support homeless families, and those at imminent risk of homelessness with basic needs services, parent education, and case management. What is great about our location is that we're located in a central area of San Francisco. We are located 2 blocks away from City Hall, right across the street from the San Francisco Main Public Library and the Tenderloin District. We are easily accessible by public transportation. Next slide.
Our mission at Compass is to support families experiencing homelessness or at risk of homelessness achieve financial stability, economic self-sufficiency, and overall well-being. At the FRC, we support the organization's mission by connecting families experiencing homelessness to internal programs and external resources so they can provide sustainable housing and wellness for their children. Next slide.
At Compass, family stability is our Northern Star. As you can see, there are 4 focus areas of family stability, that being health, childcare, housing, and income. We support families meet goals in these 4 areas of stability with a strength-based approach, acknowledging that families come in at different points, as indicated in the diagram in front of you. Our goal is to have upward mobility and have families reach their Northern Star. We want them to reach successful managing of health challenges, reliable childcare, that they're housed in market rate or affordable housing, and adequate employment, which provides income to meet basic needs supplies. Families are only considered stabilized when they reach their Northern Star in these 4 focus areas. Next slide.
At Compass, diversity, equity, inclusion, and belonging is a vital tenet to the work that we do with families and the work that we do in hiring in supporting the clients that or the participants that we work with. It is important that our staff reflect the diversity of our community and the language capacity of our families. We pride ourselves on promoting a culture of inclusion that creates a warm and welcoming space for families visiting our Family Resource Center. Next slide. A core tenet of the work that we do at the Family Resource Center is collaboration with the Central City Access Point in San Francisco. An access point, as defined by the city's homelessness response, is where folks who are at imminent risk of homelessness or actively experiencing homelessness come to seek shelter and housing information and resources. The Compass Family Resource Center team screens participants seeking housing assistance by asking if they are experiencing homelessness in San Francisco, have children under the age of 18 under their custody, and are seeking immediate assistance with shelter or moving costs. The majority of clients fall into 3 categories for housing opportunities. The first being problem-solving status, which is where families are eligible to receive assistance with moving costs, which is the first month's rent and security deposit, or relocation costs, which includes airfare, train fare, or bus fare. For families in this situation, either they don't have the funds to relocate to family who are out of state or out of the city, who do have stable housing, or they have an opportunity to rent an apartment in San Francisco or in a neighboring county, but don't have enough money to cover very high first month and security deposit costs. The second category is rapid rehousing. Families are eligible to receive a 12 to 24 month subsidy. These families are first placed in a shelter, a family shelter, as mentioned before, where in many situations they have to be separated due to space or barriers with men not being allowed in the shelters. Families are in these shelters for about 3 to 6 months, sometimes all the way up to 9 months, while they wait to be promoted up to the subsidy queue. Once partnered with the subsidy, they're linked with a program within Compass or other subsidy programs in the city to help them search for housing and remain stably housed after their subsidy runs out. The third category is permanent supportive housing, which is a unit with an affordable housing building or a lifelong subsidy. Families who qualify for permanent supportive housing have either experienced generational homelessness or have barriers that limit their ability to pay rent consistently or be able to live on their own independently. In these instances, as mentioned in this slide, families receive a lifelong subsidy or a portion of their rent subsidized through the time that they are in this unit. Next slide.
Now we're going to take a look at who we serve through the Compass Family Resource Center. As you can see, this data was pulled from Q4 fiscal year 22-23. So that is fairly recent, like last month recent. As you can see, the families that access our services are mainly Hispanic or Latinx at 40%, followed by our Black or African American families at 27.8%. And then we have our multiracial, multi-ethnicity families at 20.5%. To continue looking at who we serve, we can proceed to the following slide. And again, this data is from our Q4 fiscal year 22-23. And as far as we look at the family composition, you can see that the majority of families that we serve are identified as single women, single moms, I should say, having children between the ages of 0 to 5 at 19% and 6 to 15 at 14.1%. We are looking to expand our services into serving our fathers and our teens and TAYs a little bit more in the future. Next slide. These are the services that the drop-in Compass Family Resource Center provides. We have three main pillars that make up the Compass Family Resource Center. Those being the drop-in services, parent education services, and case management. In drop-in services, we have sub-services being basic need supplies, having food and formula, diapers and wipes, hygiene and hygiene supplies, including shampoos, deodorants, toothbrushes, toothpaste, and various items of hygiene, COVID supplies, including face masks and tests, and multiple donations, including clothing, a variety of clothing, such as shirts, undergarments, pants, socks, you name it. Additionally, we have information and resources, which are both for internal and external programming and services. We also have on-site child watch, which is essentially a space where kids can be taken care of so they are not in the appointments with the parents and they don't have to absorb the traumas or be triggered. Additionally, we have our mail service, so families can continue to receive those important pieces of information, being documents from school, from legal services, from public benefits. We want families to continue to receive these important pieces of information. Additionally, we are a diaper bank in the city of San Francisco, which means that we provide diapers to those families that receive public benefit. We are one of, I want to say, 13 providers in San Francisco that support families with this diaper bank access. And through the drop-in service, we also have our counselor of the day, which is a service that we have with our Compass Behavioral Health program, in which we have a therapy intern accessible for families through the drop-in service, where they can help families process traumas and emotions that they can be dealing with that particular day. Aside from our drop-in services, we have parent education services. We have our curriculum-based parenting series, Triple P, which is a worldwide evidence-based positive parenting program. We also have our parent-child interactive groups, which are learn and play groups for families to teach early literacy according to developmental stages of the child. We have workshops in different areas, including navigating and partnering with schools, child development, health and wellness, perinatal and early infancy. We have parent and peer support groups. The peer-led support groups that we currently offer are Parents Cafe, which we discuss, have a guided discussions with protective factors. And we also have our staff facilitated support groups, which right now we are offering our mother support groups, which essentially is a craft activity with guided discussions as well. We are looking to expand our parent peer support groups to meet services for our fathers. but in parent education, additionally, we have our one-on-one perinatal support for families as well. Moving on to our last service, it is our case management service. We provide intensive service case management, which is a weekly contact and a service plan with a family assessment matrix, which requires one contact per week at minimum. And families are prioritized for case management when they have children from ages 0 to 5. Additionally, we have another form of case management, which is family advocacy, which is a short-term resource and referral service, which offers a service plan and a family assessment as well, which reduce frequency of as needed. And those are the services that we provide through the Compass Family Resource Center. Next slide.
As part of the Family Resource Center, and as mentioned before, we utilize the protective factors framework in all of the services that we provide. In the treatment and the welcoming of clients in our drop-in center, we make sure to utilize strength-based approach that is evident in the work of the protective factors framework. In our parent education, we promote social and emotional competency of the child, parental resilience, and understanding child development, as well as through our parent cafes, we promote social support, as well as passing out information and resources in our drop-in center. We also invite families to participate in community events that we partner with or that are happening outside the doors of Compass. And through our basic needs supplies, as just mentioned, we offer concrete support to families, providing extra food or diapers so that they don't have to use out-of-pocket money or resources to provide those needs for their children. Next slide.
Hi, my name is Monica James. I lived in San Francisco since 2018. I've been a part of Compass since 2018. I have 4 children who are 19, 16, 8, and 6. I participated in Compass services during my time with Compass. I have participated in multiple services with Family Resource Center. I took a part in Triple P parenting skills classes, which helped me learn skills to help my children, such as taking them on walks and encourage them to take part in activities. I have taken part in drop-in services, picking up food bags, hygiene kit, diapers, COVID supplies weekly. I also received therapy support from the behavioral health program. Through Compass, I got referred to food programs called Refectorial, where I pick up extra food on Mondays and Fridays and dine in on Wednesday nights. This program have helped me connect with other families and community, where I built long-lasting relationships. Compass is my second family, and I appreciate the Family Resources Center staff who so warm and welcoming. They are like my second family to me now. And also, please reach out and ask for help. If you need help, that goes for a parent, teacher, ask for help. Do not just ask for help. Please ask for help, because there is help out there for you. Don't be afraid to help. Don't be afraid to ask. Ask if you need help, please. It will help. Thank you.
Next slide. Erica, you're on mute.
Thank you for that. How does FRC train and support direct service staff? We believe that when staff are comfortable and competent in their role, they will be less likely to experience burnout, vicarious trauma, and compassion fatigue. We take a mindful approach so that client stories don't become our own. Staff are trained to develop on-the-job self-care, such as grounding exercises. Grounding exercises are taught so that families experiences and emotions don't become our own. There is one particular grounding exercise that I'm really fond of. It calls to all your senses, and it's called the 5, 4, 3, 2, 1. How it works is before you encounter a situation where there would be an absorption or transfer of emotions or trauma, you can ground yourself so you can be in the present moment by identifying 5 things you can see, 4 things you can smell, 3 things you can touch, and so forth. That is a grounding exercise that we teach to all of our staff. Additionally, we have and teach muscle relaxation exercises and techniques. We definitely encourage the usage of PTO. We encourage our staff to drink water and take their lunch break, in addition to taking the designated breaks during their work periods. We encourage staff to establish boundaries with other staff and with their families. And we also provide professional development in the form of a monthly training day. The 4th Tuesday of every month, we close down services for clients to dedicate an entire full day for professional development and training. We also have weekly team meetings. We have case consultations where we support families as an entire team. We have weekly one-on-one supervisions, and we also have clinical support so that we don't experience burnout, vicarious trauma, or compassion fatigue. Next slide.
So for our Compass Family Resource Center, some of the lessons that we have learned and some of the challenges from our time working at Compass and in this field are an increased need for all services. We found that the more that we serve, the more demand for our services there are. So there are always opportunities for more funding to receive and more support from donations, whether that is monetary donations, physical donations, or even just volunteers helping us make food bags or other items in our Family Resource Center. Another lesson that we've learned is it's very important to build new relationships with other organizations. Monica mentioned the community partner, the food program Refectorio. That has been a huge success for not only us at the Compass Family Resource Center, but for all of our families who have been able to utilize the service. It helps families not have to worry about putting food on the table. And not only that, but they're treated so wonderfully, and it's really built a sense of community in the family network of our resource center. Erica and myself, with the help of our support staff, have created new positions and trained them over the last year. A navigation specialist whose job it is to connect to other FRCs and to update our resources and referrals on a weekly basis. This has helped us make more informed referrals within the community, connect families to other FRCs or other organizations in the city or Bay Area who do similar work or who have more focused support that they can offer a family that we're working with. And as well as the intake position that controls all of our intakes coming in and out, makes informed referrals, and helps support families when they come in for the first time seeking services with Compass. As Erica mentioned, staff are encouraged to use PTO and develop on-the-job self-care techniques. In this field, burnout is very high and turnover happens very regularly, not just at our FRC, but in many Compass programs and as a whole in the nonprofit world. So a lesson learned is that encouraging staff to use time off and to take care of their own mental health or self-care before serving the families helps not only our staff remain in these positions for a longer time, but it also helps our families receive more focused and intentional work and care. Next slide. So for any of you out there who are just starting to support families experiencing homelessness or who are low income, wherever you are, we have identified a few of our suggestions for getting started. So one of them, as we mentioned in the previous slide, identify drop-in centers in your area or other programs doing similar work. It can be hard if we're all working in silo, but if we work together and bridge these gaps, and make sure that families are being referred to other community partners that are doing more similar work or have more capacity. That goes a long way in supporting the families that come through our doors. We also identify other services available in the community. So having positions available that do research or that can have time going out in the community and engaging with community partners is really important as well. And then one of the big ones for us is gathering feedback from participants, as well as staff, and then parent advisory groups as well. So over the last few years, we've had both surveys and advisory groups where we reached out to our families in particular to give us feedback on the services that we've been providing. We have learned where there are some gaps in the work that we are providing, as well as some of the areas that we are really succeeding at with families. So in many ways, we start with surveys, getting a general feel for what clients or families' experiences are when coming through our doors. And then we do parent advisory groups, which are smaller groups of parents who are active in our programs to get a better sense for what their day-to-day experiences are, both good and bad, to inform the work that we continue to do. Next slide.
So we had to do some remodeling of the Compass Family Resource Center based on the feedback from staff, clients, and staff, families, and parent advisory groups. We have taken the approach of humanity first, services seconds. What that means is that we remodel our space so that it is inviting and welcoming to our families. We purchase new furniture, sofas, tables, so that we can treat our families with dignities. When families arrive on site, they are offered food and water. We also set expectations for their services and their time. We have a free book library so that children on site have access to books, and they are also able to take them home. We have books for all ages of children. We also have a flyer display wall with 52 active flyers with services within San Francisco. We also have staff that reflect the diversity of our communities that we serve. We also had to restructure the systems. We also had to restructure systems to meet our practices. We have improved our communication across teams, and we have revised our FRC manual to align with our growth and with the demand of our families. And we have also shifted our onboarding and orientation for new hires to be more intentional and strategic. Next slide.
So thank you for hearing us share about our Family Resource Center. If you're interested in learning more, you can visit us at our website, www.compass-sf.org. If you're in San Francisco, feel free to pay us a visit at 37 Grove Street. As Erica mentioned, 2 blocks from City Hall and right across from the public library. If you're interested in learning more about our program and don't live in the Bay Area, you can also email both of us directly. This is Erica's email, ebarajas@compass-sf.org, and my email, cweininger@compass-sf.org. You can also follow us on social media for any updates. We post regularly on our Instagram page, which you can see @CompassSF, backpack giveaways, and other promotional events. And you can follow us at Twitter, Facebook, and LinkedIn for more information as well. Thank you for your time.
Thank you so much, Clark, Erica, and Monica, for your presentation. Now we are going to move to Arvin Family Resource Center and invite Mario and Liliana on.
All right. Good morning and or good afternoon, wherever in the country you may find yourself. My name is Mario Venegas, and I am the Director of Support Services here for the Arvin Union School District, and I oversee our Arvin Family Resource Center here. And then today with me is Ms. Liliana Carranza, who is our Support Services Advocate here at the Arvin Family Resource Center. Next slide, please. So as an LEA-based, primarily FRC, we fall under the Arvin Union School District, where our mission is every child learning every day, no matter what it takes. And what we really do, we really take that to heart here. And the FRC is one of the primary components that is within the continuum of integrated student supports here within our district, in really helping to ensure that we're supporting our school sites as well as our community and helping our students learn every day. The Arvin Family Resource Center is a program within Arvin Union School District. We are very passionate about student education and recognize that there are additional factors that affect learning. We collaborate with the families in our schools and the Arvin community to provide support services and referrals. And we partner with other community-based organizations in the surrounding area to cultivate a collaborative network to better serve our schools and our community as well. So there you'll see is our office. We do in the winters have a pretty beautiful view of snow-capped mountains here in Arvin, but it's also very hot. And I did see we are located in California. And then there is a picture of our Arvin Family Resource Center on one of our elementary school campuses. Next slide, please. So I'd talk a little bit about our community demographics. Where San Francisco is very urban, we are more of a rural environment here in the south central part of the state. We're the southern tip, or what we call the South Valley area of the Central Valley. We're about 99 miles north of Los Angeles. LA County is our neighboring county to the south, but our community demographics very much involve Spanish-speaking communities here in the city of Arvin. We also have some indigenous languages that we work with here at the FRC and collaborate with a couple of other organizations locally where they speak more of an indigenous dialect called the Mixteco. We also have a small Arabic population here in Arvin as well. We have a heavy concentration of farm workers. We work heavily even with migrant families, where several of our families start in the school year down in the Coachella Valley area, which is out near Palm Springs, and kind of follow the crops and the harvest up through the state, all the way up into Salinas, California, and the Monterey area. So we do have some transiency in that regard as well, in some of the students navigating the migrant flow of work that exists in the agricultural communities here in California. We do have a heavy Title I population as well, which is socioeconomically disadvantaged. So a lot of our students, well over 90%, are under the federal poverty threshold and would meet eligibility for Title I. We're about 20,000 residents here in the city of Arvin, and our district has a population of about 3,000 students. Next slide, please. So one of the unique things about the Arvin FRC is that we are primarily what we call an LEA, or local educational agency based FRC. So we are all school district employees of Arvin Union School District. And so what we're looking at is we provide school-based services, but we still have a community focus and component to it, because that was really how the FRC traditionally started here in Arvin. It was more of a community center, but through the shift in landscape and the needs of the community, it really expanded and started branching out into becoming more focused and integrated on LEA programs, which we'll talk about a little shortly. So in our school district specifically, we have 3 elementary school districts, 1 middle school. We have about 3,000 students, and we primarily service our homeless and foster youth. We also center some of our work around attendance, making sure that students are ready for school readiness, meaning they have uniforms, they have their supplies. We also assist with the social emotional behavioral supports. And on the community side, we provide targeted case management to a lot of families. We also have a grant with First Five of California and Kern specifically, where we're working on meeting developmental milestones and parenting education and providing educational workshops on the development of 0 to 5 to ensure that now we're also helping with that we call cradle to career, right? Making sure that students are getting all the supports necessary from 0 all the way through some kind of career and technical education. We also provide a lot of services. One of the biggest ones is really around Medi-Cal, making sure that our families here in the area are Medi-Cal eligible, getting applied for Medi-Cal, or what would be the Medicaid. We also have Covered California, which is what stemmed from the Obamacare policy. We help with CalFresh applications or SNAP. We have a great relationship, and we co-locate services with our Employment Development Department to provide unemployment benefits, disability. We also assist with Social Security. retirement, and also with some citizenship applications and I-90s, which are the green card renewals or for their long-term residents here, as well as some parenting education. Next slide, please. So our primary purview here, when we deal with homelessness specifically as an LEA-focused FRC, is a little different than the HUD version. So we also operate under a different definition. So the definition we honor here, or that we are legally bound by for homeless education, is specifically under the McKinney-Vento Act, which is a federal policy. So this requires, this is information that's pertinent to every single state in our country. And what it is it defines homeless children as youth who lack a regular, fixed, and adequate nighttime residence. One of the biggest differentiating factors between the HUD definition and the McKinney-Vento definition is that we do include doubled up as part of our student population. So if they're couch surfing, if they're sharing a housing or a residence with another family member, so long as it's because of a loss of prior housing or demonstrated economic hardship, they would qualify as homeless under the McKinney-Vento Act. But that doesn't necessarily mean that in receiving community-based supports who operate more under the HUD definition, that they would qualify per se for their services. But every school district is required by federal law under the McKinney-Vento Homeless Education Act to ensure that they are supporting homeless students under that definition. And part of the work that we have to do, so I am the designated liaison, the homeless liaison for our district. So it's my job, part of my job, to ensure that I'm meeting all of the compliance. There's 10 overarching factors that we have to ensure that we're doing to support the education and success of our students here in local education agencies. Among them are ensuring we're complying, ensuring that students and families have the right to access their school of origin. So for example, we have a couple of students that had their primary residence and district of origin here in Arvin Union School District, but because we don't have any direct homeless shelters here or any kind of shelter to house families, they would often go to the city Bakersfield, which is where we're at, but they under the law still have a right to get their matriculation and to still continue to be students here in Arvin Union School District. And part of our responsibilities as a district and as a liaison is to ensure that we're educating our homeless families or our families experiencing homelessness on their rights and protections. So they're not forced to have to go to the school district that pertains to where maybe the shelter is at. We have to still be able to provide them here within our district of origin or school of residence, which is the language that we use. And so we have duties, again, to ensure that they're accessing equal education. We can't deny students transportation. We can't deny them equal rights participation to extracurricular activities. It really is incumbent upon the liaison and any staff to make sure that we're providing all of the holistic needs to ensure student success, and then also to keep them enrolled. If people listening today are not familiar, if a student is determined eligible, for example, for McKinney-Vento homeless education, they have the ability to enroll into school immediately, which means they don't have to have their tuberculosis on hand, their immunizations on hand, demonstrated proof that they are living at a residence, which are some of the things that are required to successfully enroll students in class. If they are determined or they're linked to McKinney-Vento, they do have access to be enrolled in school immediately without all the necessary documents. And here in California specifically, we recently had 2 bills introduced in our legislature in 2021 to really get more proactive and to ensure that we are screening and taking proactive measures to ensure that we're assessing students who might be experiencing homelessness. And so through our California Assembly Bill 27, we are now legally responsible here in the state of California for ensuring that we are administering what we call a housing questionnaire. So we're asking if families have, adequate, fixed, and regular nighttime residence, and if not, then what are some of the limitations that they have, so that we can off the bat already begin to get students enrolled immediately if they do meet eligibility and it doesn't keep them out of school for a prolonged period of time. We also have our Senate Bill 400, which now requires myself as a liaison to ensure that all of our school district employees are trained on knowing what are the signs and maybe some common phrases or verbiages or behaviors that we might be seeing for students who might be experiencing homelessness. So those are two big important features that are unique to California that we have to do to ensure that we are proactively assessing, screening, and identifying students who might be eligible for McKinney-Vento homeless assistance. Next slide, please. And so one of the unique things about us is that because we don't meet the HUD definition, we're not eligible per se to get some of the HUD funding. So we have to get a little creative in school districts, because although we have a lot of law that tells us we have to complete these programs to ensure we're meeting the success of students experiencing and families experiencing homelessness. So what we do is what we call a lot of blending and braiding when we can, when the law permits and the guidelines permit. So we do have programs here specifically that we operate out of the FRC and through our district. The first being the McKinney-Vento Homeless Assistance Program. We also are moving towards a community schools initiative, which is getting much more holistic and collaborative and ensuring that students are getting the whole child needs met. We recently received a grant with the state of California to embark on a student behavioral health incentive program, which we're very much excited for. And that's going to give us the ability, part of our ideas of what we're looking at doing, and is actually building kind of an outpatient mental health clinic here as well, to help support and then to also work with coordinated entry points for homeless programs in our county. We will also support students using Section 504 plans if that's something that they're eligible for, as well as an IEP. And then again, we have our First 5 Kern program that we can help support our families as well. And so funding is always one of the interesting things that we work on, but we are deliberately and intentionally trying to ensure that we can sustain these programs and services for our families, because we are finding that they're very much needed for our community, for our families, and for our students. So under the McKinney-Vento Act, you can access Title I Part A funds to directly support all of your homeless programming within your school districts. We also tap into our local control accountability plan here in California. We have the local control funding formula where school districts have some good autonomy on being able to really stipulate some goals and use funding to directly support some high need student subgroups, which homeless students are one of those subgroups for LCAP funding. Again, we use our First 5 funding. We also use our school-based medical administrative activities, or ESMA, funding here, and then as well as our LEA billing options program through Medi-Cal as well. Next slide. So I wanted to talk a little bit about the continuum of care, because the FRC here, poised as an LEA FRC, is really in a unique position. So we know that all of these elements are necessary to ensure student success and maximize learning outcomes in the school. So we know kids need to be fed, they need to have nutrition, they need to have proper health care, they need to be able to have transportation to get to school, childcare, you know, and make sure they have some income and budget. But the school district necessarily cannot be the provider of all of those services. At the end of the day, the school district is primarily responsible for the learning of the student, but we do know that students have to be regulated, have to feel related and connected and safe in their school environments, and get the necessary support services needed to ensure that they're ready to come to school to learn. So we partner with a lot of community agencies off to the right who have particular niches in each one of these service categories, because we know that as an LEA-based school and a district and even an FRC, we cannot provide in-house all of these necessary services. So we really rely on our community partner agencies to ensure that we're working and linking and serving as that liaison between having direct communication with our school sites and direct communication and access with our partners in the community to ensure that we are extending that continuum of care to minimize the ability of students falling through the cracks, so to speak. Next slide, please. And so in that, the ARVN FRC specifically takes on a multi-agency approach. We work with neighboring districts who are very similar in demographic to us. A lot of our students do bounce around from ARVN and the communities of Wheat Patch, Lamont. And so we work and we have great relationships with our partnering school districts to ensure that we let them know and we're communicating with each other of students who might be experiencing some transiency and making sure that we help support that. So again, they don't fall off the radar. We are heavily involved, as I'll talk in the next slide, with our community-based organizations because we recognize that as an LEA-based FRC, we cannot provide all the services necessary to help maximize the efficiency of self-sufficiency for our families and our students. We also partner with healthcare organizations. We've developed in the past 2 years really strong relationships with Dignity Health, Kern Medical, Kaiser, and Kern Family, which are our big 4 primary healthcare organizations. And I'll talk a little bit about one of the cool, fun events that we structured and organized with them to bring those necessary primary and prevention services here to our school district. And we also work with our local charitable organizations, things like a Lions Club, our chambers of commerces. We really get them integrated because they do a lot of donations work and community work for a lot of our families and districts here. And we actually have gotten really good at partnering with our political offices. So we now have members, community reps, and chiefs of staff from our local supervisor, from our assembly member at the state legislature, as well as our congressman at the federal level. And we'll see a little bit about kind of what that looks like in the next slide. So in bringing the multi-agencies together, knowing that the school district and the FRC alone cannot provide all of the necessary services for our students and families who are experiencing homelessness, we've developed the South Valley Neighborhood Partnership, which this year celebrated its 30th birthday. As you can see in the lower left-hand side, we had a big birthday party where we commemorated and we provided awards for all of our community service providers, honoring some that have been really helpful in streamlining and getting our families access to immediate services when they haven't been contacted or they've been on a wait list for an extended period of time. Those connections and this partnership that comes together on a monthly basis really comes together to really troubleshoot and expedite services needed for our students here in our FRC, as well as our district. We bring them together to survey and assess what are the challenges you're seeing out in the community that we can help focus on here in the school districts. Because here are the things we're seeing at the school districts that we need your help on. Hold our hand in this, team up with us, partner with us to ensure that we're working together and we create those open lines of communication so that we're servicing our students the best way possible. And again, we have workshops where we bring them together, we give them some food, we treat them, and we say, hey, we need your brains around this. Schools cannot solve this alone. How can we problem solve this particular data that we're seeing or this trend that we're seeing? And so I really appreciate the beauty of this South Valley Neighborhood Partnership, which is a collaborative between our school district and one of our neighboring school districts, where we bring together anywhere between 30 and 50 partners together in one room to really help problem solve all of those necessary components that you see there in that slide to ensure we're working together and effectively. Next slide, please. So through some of those gatherings that we all convene, we get the opportunity to kind of build these really awesome events that we're super happy and proud of. You see some pictures here, for example, in the top left, that is one of the mobile health clinics that we got our healthcare organization partners and hospitals to come out, because access to services here in Arvin is really limited. We don't have any type of hospital services. At most, we can do urgent care here, but anything that is pressing or really emergency services, if you have to go by ambulance, it is about a 30 to 45 minute ambulance ride to get to the nearest hospital from where we're located. So one of the things that we talked about that we identified as a gap really was, how do we bring then those necessary preventative healthcare services? How do we catch things sooner? So we got together and we developed this Healthful Harvest, where the 4 major hospitals come in, they bring their mobile clinics, they give immunizations, they do vision screenings, they prepare them for glasses, last year they did breast screening, cancer screenings, cervical screenings, all of these different preventative services. And they brought their big diesels and big RVs that they've converted so that they got to get their services here within their community on one of our middle school campuses so that they can get the access that they needed. We brought in all of our community partners and vendors so that the family's well aware of all of the services available, whether it be for health, electricity, rental utility assistance, food. United Way of Kern, for example, came and provided over 350 food boxes of non-perishable goods for our families as well. And as you could see there, even our assembly members showed up, popped up a tent and started promoting and talking about what can his office do to help support the community. And in the bottom right, bottom right, you see that's our mayor here in the city of Arvin. We did a partnering community event with Flood Ministries, which is our local homeless specific provider here in Arvin that we're very fortunate to have now. And we joined together to do a community event there as well. And our mayor came out to support. Next slide. And then we also have the opportunity to kind of have some fun and do things here directly as an FRC. So what you see here is we worked with, again, Dignity Health, one of our health organizations, and they said, hey, we really want to donate, some Christmas gifts or holiday gift items. And we said, we know our McKinney-Vento or students experiencing homelessness, this may be the only gift they may get this year. And so we wanted to make sure we really prioritize them. So we did a holiday shop. We got a bunch of donations, gifts from some of the healthcare providers, some of the local charitable organizations. We dressed up as the Grinch. We brought in our families. They got to get a gift, take a picture by the tree. We provided some Mexican hot chocolate, some pan dulce for our families. And so it was a really exciting time. And it was the first time we got the opportunity to really engage our families and students experiencing homelessness to get some kind of gift or holiday season. We also did a joint event recently last month with our Boys and Girls Club, where they came and they provided $150, $100 food gift cards to tackle food insecurity. And we prioritized our families who are experiencing homelessness for this. And they also got a laundry basket full of household items, toiletries, toilet paper, paper towels, laundry detergent. So really to help reduce some of the everyday things that we who don't experience homelessness or aren't socioeconomically disadvantaged don't have to think about. We're able to provide those to our families as well. And there you see one of our other advocates as well, who was out there dancing with our kiddos out at the fair, doing some health related classes with one of our organizations, out there doing some Zumba. And so we do a lot of fun events here at the FRC. We're really excited not only to partner and do large scale events with all of our partners that participate in our work with the FRC here, but we're really excited that we can also do some unique things individually within the auspice of our school district to help support our families. Next slide, please. And so with that, I will hand it over to our support services advocate, Mrs. Carranza.
Hello, everybody. So we support with utilizing FRC support services. So as a support service advocate, we support with screening our families in our district with the student housing questionnaire. And once eligibility is determined, we are able to invite the families to our office just to introduce ourselves, introduce the services that we provide in our Family Resource Center, and also be able to assess any needs that they might have. Once they is shared with us, we provide them either most of our common ones, as Mario had mentioned, is applying for medical insurance, or applying for food assistance. We're also able to provide our students that are part of McKinney-Vento with school materials to prepare them for school readiness, prepare them with uniforms, water bottles, hygiene kits, first aid kits. Also, some of the families are not able to come into our office due to transportation themselves, so we're able to conduct home visits for them. And we're also able to provide transportation for these families as well. Since some of our families that are considered McKinney-Vento, some of them are placed in motels for temporarily. Motels are here 25 miles away from here, so we're able to arrange transportation services with our transportation department, or we are also able to reimburse them mileage as well. Next slide. So optimizing self-sufficiency. So we do care calls to these families on a monthly basis to know what the family's needs are. We ask them if there's any strengths, any barriers, any challenges they might have, and that's when they share with us any concerns they might have. And this is when we link them as Mario had mentioned, through our community partners, we collaborate, we're able to learn about them, and then we're able to bring these agencies to our families. We're able to share with them, that way we can link them and connect them together. One of them is the Unemployment Development Department, where they come on a weekly basis to our office and assist families with paid family leave, disability, unemployment, which is very common here in our community. And we get a good population of, or a good amount of people coming into our office on those days. Also, we're able to connect them with greater legal Bakersfield assistance. One of that is for housing rights, renters' rights, which is really great for to our families. And any families dealing with any domestic violence, we're able to refer them to the Family Justice Center as well. Next slide. So ensuring student success. So not only do we work with community agencies, but we also work with school personnel. We're able to help assisting monitoring attendance for these kids. We're able to communicate with teachers and admin about the children academics, versus like if they have any needs, like any laptops, internet connections, extra support with schoolwork, academics. That is some of the stuff that we do to work closely with our schools to assure that the kids are doing well at school as well. Any mental health support as well. Health and wellness, has how Mario had mentioned, our McKinney-Vento students, if they are not up to date with their immunization shots, they are allowed to still come to school versus a student who is not McKinney-Vento. But we do try to connect them with agencies. We do try to with our collaborations with clinics, we try to connect with our clinics to be able to connect with our families. So we're able to schedule an appointment so we can make it possible for these families to make sure these families are able to schedule an appointments to be able to get those immunizations or those doctor visits in. And if they don't have insurance, then that's when we can come in as well and help them apply for insurance as well. Next slide. So collaborating to end homelessness. So these are some of just of our agencies that we work with very closely to help end homelessness with. These agencies are able to case manage our families and be able to place them into shelters, and also be able to work with them and to get them into a stable living place. So Arvin Navigation Center, which is Blood Ministries, there are our big one that we connect with in Arvin, because they're located in Arvin. I have gone with like the social worker from the school just to get more information and see what can they provide. That way we are able to bring it to our families and then conduct those home visits and let the families know as well. Next slide.
All right, so in all that, here are a couple lessons. You know, everything probably sounds nice, but it wasn't all nice to begin with. And so we definitely had some learning lessons as we went on. And here are a couple of things that we've experienced in our process and ability to get to where we are today that we'd like to share with the group. And the first really is focusing on proactive engagement. You know, oftentimes I know I came from, you know, the domestic violence, sexual assault world prior to coming into education and schools. And oftentimes, you know, service deliveries don't kick in until there is already a need or a crisis. And so one of the things that we've really kind of flipped the script on for ourselves here at the FRC is that we are really getting family-centered and student-centered, and really focusing on building caring relationships and focusing on universal support strategies to try to prevent the need or possibility of crises. And so one of the things that we've really taken on, and one prime example of how this first lesson learned of proactive engagement has helped. So across the nation, really, we're seeing this, and in California specifically, and it wasn't unique, and it wasn't this unique to us last year. Or 2 years ago, but foster youth specifically, you know, usually have one of the most chronic attendance rates, right? And so even our homeless students often have some of the highest chronic attendance rates. And so what we've done is now we've purposefully changed a little bit of how we approach our family-centered work here at the FRC, and we do monthly care calls. We're not waiting for them to tell us, I'm out of food. The uniforms are ripped. I can't come to school. We are checking in with them proactively, saying, hey, we want you to know we're here. We want you to know we care. We want you to know that these are still your rights and protections. We try to destigmatize the need for mental health, behavioral health, the need for economic health and relief for a lot of our families. And again, here working uniquely with immigrant farming populations and Latino populations, sometimes we do have to do a lot of that destigmatization work. And that proactive engagement has really helped flip the script. So it has already decreased significantly our foster youth, for example. Chronic absenteeisms, we went from into the 90% of being chronically absent to less than 1% in last year in getting proactive. Our homeless population, although still our toughest population, we've already seen good shifts in our data to helping to ensure that absenteeism is beginning to be reduced. We still have more work to do, but last year we've begun to see a reduction and an increase in student attendance specifically through the proactive engagement. So again, we're not waiting for a crisis or a big need to happen for a family to decompensate. We do those carrying calls on a monthly basis and we're checking in with it, even if it's just, we remember your name, we know who you are, we're here and we care. And we also have learned that we have diverse subgroups, right? We have homeless students. We also have unaccompanied youth, which are youth who are homeless, but also not living under the care of their parent or guardian. So these could be runaway youth, for example, or these could be youth that or students where a biological parent has entrusted a family friend or an extended relative or another immediate relative to place their child in their home, but they're not living directly with them. So one example is we have a family that lives out about 2.5 hours north of here who brought their student to live with their sister here in Arvin Union School District. And we still enrolled them because, again, a school district would say, well, we don't have the biological parent, but if we know and we've had access and we've engaged that family to know their story about what led that here, rather than shaming, blaming it, targeting it from a legal compliance, we say, okay, well, then you would qualify for unaccompanied homeless youth. Let's get you into school now. There's no time to waste and rob you of your learning time to try to fact check everything that we got. If you know that you meet eligibility for unaccompanied homeless youth, then let's get you into school and we'll figure the rest out later. And again, our migrant populations. So it's been interesting. Each one kind of has their own uniqueness to what we do, but we've gotten very purposeful in trying to strategize around how to support each one of those unique categories. Again, intentional communication with school sites is really key. I think, again, one of the uniqueness about the Arvin FRC is that we have direct access as school district employees to, as Ms. Carranza said, admin, teachers, school social workers, school psychologists, all of the people on site helping to support the student. And we have direct access to all of our community providers here in the area. So, we can be that liaison in making sure that the students are getting connected and that continuum of care continues by bridging that service. So it's not just the school site saying, hey, go call this agency, go get a referral, sign up. We can help track, progress monitor, and make sure that we are making that student is getting or that family is accessing the needs that they did. And the other thing is, oftentimes, especially when we look at, homelessness or families experiencing homelessness, we often think that permanent housing is our primary solution. And of course, to eradicate, to reduce experiencing homelessness, that is the primary solution, right? But sometimes the family's priority isn't necessarily our priority of eradicating or stabilizing that homelessness. For some families, it might be, I'm not looking at getting a place right now because I am having, I'm sleeping in my car because of domestic violence, right? I'm not in my home because of this. And so we need to reprioritize and say, okay, well, although we're still going to work towards family stability and self-sufficiency, right now your priority is getting you linked to the Family Justice Center so you can get connected to a domestic violence advocate and ensure that you get the services you need. So that's one of the things that we've learned here at FRC is that sometimes we have our treatment goals and our target goals of what we want our families to achieve, but we have to remember we have to be where they are and ensure that we're still being family-centered and focused and making sure that we're checking off their primary needs first to ultimately help them get to self-sufficiency. Next slide. And to get started, if you're looking at, developing an LEA, I know with community schools, which is a national movement right now, if you're not familiar, maybe familiarize yourself with your local school districts. But the biggest thing is you got to know the law. When it comes to LEA, we have so much legal compliance that we have to get under. So knowing how to properly screen and how to identify who homeless families experiencing homelessness are, we got to know the law. So that is very, very, very important. Know who your McKinney-Vento liaisons are. Again, that is a federal policy. So every school district in this nation needs to appoint a designated LEA homeless liaison. And you can use them as a resource, even if you're a community serving agency. How do you engage your school districts, your school sites, your school-based FRCs, if there's some, or at the very least, the homeless liaison to help support? Because if there are potential issues with transportation, as Ms. Carranza said, not oftentimes we're not legally responsible per se to actually pick up and drop off. If that's a resource that the school district has and can afford, definitely can. But other ways we've done mileage reimbursements. So I know when I was in the community-based agency, we didn't do mileage reimbursements for, participants who are receiving services. But if you were working with homeless families or families experiencing homelessness, you could tap on your McKinney-Vento liaisons and say, hey, what services do you guys have to help ensure transportation needs are being supported by students experiencing homelessness? And so know who, again, if you're not a community homeless serving agency, know who they are, because they are essential partners. So as we said, we have entry points here. We now work very closely with Flood Ministries and and the Open Door Network, because those are our two, similar to Compass Point, that's their niche. That's their primary work and what they do. They are the experts in helping to eradicate and stabilize homelessness, where we recognize that we're not, but we work really closely with them to ensure that we're collaborating that happens. Establish a network of providers. I think similarly, nobody has the niche to cover every single one of those necessary components. Collaboration is essential to helping, because homelessness really is a systems issue and a systems problem, and it needs a systems response. And really providing awareness and education. Like I said, part of what we have to do is we have to even put out postings out in the community as one of my compliance measures under federal law. I have to go out and encourage libraries, encourage markets, encourage all the different health providers in the area to put up our McKinney-Vento protection and rights flyers, so that families, if they're not in the school, hopefully they can see that and say, oh, I qualify for some of those things. Maybe I need to talk to somebody at my school district to see what they can do and how they can help. So providing awareness and education, we often talk about it, whether we're talking explicitly about McKinney-Vento and homelessness or not. This is one of the big topics that we do and when we do some awareness and education out in the communities here in Kern County. Next slide. All right, well, with that being said, thank you very much. We thank you for hearing us out and the opportunity to share our story and a little bit of our work with you all today.
Thank you so much, Mario and Liliana, for sharing the supports that Arvin FRC provides. Thank you. So, folks, we have come to the time for Q&A. So again, there will be a brief webinar survey that pops up at the close of this webinar where you all can provide more feedback. So would love to, let's take a look here at the Q&A. And if you have questions, please go ahead and put those in there. Just so you know, we had a couple that were answered in the chat. Looking at the, let's see, the links are, oh yeah, all the links that are on the slide will be available by this time tomorrow on our website. All right. So we have a question. Let's see. Sonia lives and works in the LA area. Oh, she's asking about Shields of Hope. And I believe that that was in the chat. So if we have participants from Shields of Hope that are still on the call, please go ahead and drop your contact information in the chat so that you all can connect. All right. Let's see. So we have a question here. It says, can both of the FRCs that are presenting today share your outcomes for number of families served to number of families who ended homeless or became more stably housed? What are the most successful tools you use to remove barriers for families? Okay, so we have a couple of questions here, and I think one of them, and this goes for all of our presenters on here, if you guys want to come on, what kinds of outcomes might you have for families served? Understanding that stability with folks that are experiencing homelessness may take a very long time. So outcomes when it comes to homelessness with FRCs may not look like we see other outcomes. Those might be a little different, but I invite both Arvin, FRC, and Compass to go ahead and share with us here. And the outcomes that you have to share. Do we have either the FRCs? Did you all want to speak at all to outcomes that you might have?
Sure, I can hop on. Sorry, I was just wondering if our videos were going to show up, but okay, there we go. All right. So for us, that is a little bit of a challenging question. I mean, I would love to have the ability to concurrently capture that data, but we can tell you of those who have actually come back and have shared their success story with us, because oftentimes some of our families that we experience here do end up transitioning and fully over when they get into some kind of shelter or some kind of residence. And, then they continue to fulfill kind of their lives or their roles in terms of what they're doing. But what I can share that we do know as of last year, so last year we had about 89 families specifically that we were really focused on targeting that met our McKinney-Vento eligibility here in our school district. And we know of 3 that successfully engaged in some kind of transitional housing program, got into a permanent housing, and were able to get into some kind of job, vocational career. So for us, it's a little challenging because, again, we're not the specific niche. And once we ensure that that family is connected to the appropriate agency to help stabilize that, we may or may not hear from them again. Because again, we are a little bit further out. So most of these services that we talk about here are located in Bakersfield, which again is about a 30 to 40-minute drive. So, usually families, once they leave the Arvin area, we have several FRCs here in Kern County as well. One of the things that we'll do is we make sure they have the information to the nearest FRC now that is within their new residence and linking them that way. So we don't do any longitudinal follow-up in any say. Oftentimes we learn that some students have just unenrolled from our district because they've now decided to enroll in the school district where they're now located here. But what I can share that I do know from, again, families that have followed up with us or we've kept in contact with, or have even come back. Some of them do drive still all the way from Bakersfield, 40 minutes out here to get their support that they need here because they have that established connection with us. Out of the 89 families that were eligible for McKinney-Vento homeless assistance last year, we know of 3 that secured safe and stable housing outside of the Arvin area and have now transitioned to living in the Bakersfield area where they have and are connected to the supports and services out in the city there.
Thank you so much.
As for the Compass Family Resource Center, we don't have that data readily available. I'm happy to email it to you. We're still in the process of analyzing our data for the fiscal year. But what I will say is that we are currently serving 400 families with drop-in services, parent education, case management, or family advocacy. And throughout the fiscal year, we served upwards of 700 families through the Compass Family Resource Center.
Thank you so much. And folks, I'm not totally sure who asked that question, but you all can reach out to Erica and Clark in regards to the outcomes on Compass based off of the contact information that they provided on the slide. Now we have another question here regarding public housing authorities. So have you all worked with public housing authorities to access housing choice vouchers and the family self-sufficiency program at all? And that's from Ruth White, and she wanted to note that a household doesn't have to meet the HUD definition of homelessness to get a voucher and enroll in that family self-sufficiency program. But have you all interacted with public housing authorities?
I can go first here on behalf of Compass. So our program doesn't directly work with any of the city or state funded housing programs, So as I mentioned in our slide about the collaboration with the Central City Access Point, all of the clients who are actively experiencing homelessness get referred over to our access point staff who assess for eligibility for the 3 categories that I mentioned. And all of that is funded through the city's homelessness response network. And they work directly with the Housing Authority of San Francisco, in many cases, to house folks or to approve or process vouchers for these families. So just to answer it more directly, our FRC doesn't, but we connect to the programs internally at Compass to provide that direct support.
Thank you.
And similarly here at the Arvin FRC is we link directly to organizations like the Greater Bakersfield Legal Assistance, who does have direct access and linkages to more public housing and has the expertise in that realm. We have referred families like for wrongful evictions, or when they come thinking they have wrongful evictions or unstable housing due to mold, or we will refer to the Fair Housing Authority here in Kern County and help support that process as well. But we don't directly work on those voucher programs. We link them again to the particular experts in those fields that we have great partnerships with, and we make sure that we kind of co-case manage those families together to ensure that they're eligible for whatever services or voucher programs that Housing Authority may have for them.
Thank you so much. So I would like to say thank you to all of our wonderful panelists for presenting today and for answering those questions. Before we jump off this webinar and before you all get to the evaluation, I just wanted to cover a couple of resources that are available through the NFSN. We do have 2 upcoming webinar Wednesdays, the first one being on September 13th, and that is Uncovering America's Best Kept Secret, where we will talk about family resource centers and family resource center networks. And then later on that month in September, we will be spotlighting the Texas Family Support Network. And you all can register for those opportunities on our website at nationalfamilysupportnetwork.org. We also have the Standards of Quality for Family Strengthening and Support Certification Training happening in September. In order to register for that, make sure that you go onto our website by the 11th of September. We also have our very popular Developing and Sustaining Effective Parent Advisory Committees training happening in October. That one you have some more time to register for up until the 20th of October. And that is actually co-trained by the NFSN staff and an experienced national parent leader. More info is also on the website for that. Now, a couple resources here on the NFSN website. We have FRC overviews, videos, research reports, lots of different resources that will be of use to you in informing your work. And you can find that on the FRC page of the NFSN website. In addition to the webinar Wednesday page, we have our library where we list all of our past topics. So it is very possible that if you are thinking that you would like to see a webinar on a specific topic, we may have done so already. So make sure that you go on our website if you're looking for a webinar, for an informative webinar, and go on there, take a look at all the we have FRC topics, we have Family Resource Center Network topics, and Standards of Quality as well, different resources on there for you. And then we have the FRC Learning Hub. So this is a new hub that is designed to provide tools and sample materials for those who are looking to develop individual family resource centers. The hub is organized into 6 phases of developing a new family resource center, each with accompanying resources. And after you register via the webpage, accessing all of the materials is completely free. Services that are provided by the NFSN include facilitating connections to member networks that are happening or that are organized in 38 states and DC as well. We do presentations for key stakeholders, provide technical assistance to networks, and provide trainings. My contact information is here on this slide if you would like to reach out to us at the National Network. And again, thank you all so much for participating today. We really appreciate you taking a couple of moments to complete a survey and the evaluation that's going to pop up on your screen right after this. And that is going to include questions about identifying your own next steps in relation to this topic and what would support you in doing so. Thank you all so much for your time today. We'll see you next time.